Gonna give it another minute or two to let people join. All right, I think we will go ahead and get started as I have it a little past 12 o'clock right now and the pings have slowed down. So before I go ahead and officially call the roll, I will provide a few reminders. Please remember to mute yourself in your line if you are not speaking. For purpose of the minutes, we ask you when you are speaking to identify yourself in the organization before you speak. If you are on the phone and logged in via web, please turn your computer speakers off. And a reminder that any polling is reserved for board members. Finally, I will remind you that these meetings are recorded for purposes of going back and reporting minutes and the like. So by continued participation, you acknowledge the recording. So we will go ahead and get started, and I will call the roll. Cheryl Kashuba.
Good afternoon, Commissioner. I'm here.
Hey, Cheryl. I think Secretary Bogan on the line, or are you?
I am. Welcome. Nice to see everyone.
Perfect. Welcome. Frank Fernandez.
I'm here. Good afternoon.
Antoinette Kraus.
I'm here. Can you hear me?
Antoinette. Oh, there she is. Okay. Yep.
Okay.
I hear you.
Right.
Amy Lowenstein.
Yes, I'm here.
Is here. Alexis Miller.
Hello, I'm here. Thanks.
Okay. Dr. Conti.
Good afternoon. I'm here.
I believe Carl Feldman has Secretary Arkush's designee. Carl, are you on?
Good afternoon.
Very good. Colleen Kavanaugh.
Yes, I am here. Thank you.
And Tia Whitaker.
I'm here.
Very good. So we have a full quorum. First order of business will be to review and approve the minutes that the staff shared. You all should have received that and had a chance to review. Looking for a motion to adopt the minutes of our May 16th meeting of the board.
This is Cheryl. So moved.
Cheryl moves.
Second.
Do we have a second?
Frank
for a
Fernandez, second.
Very good. All in favor, say aye.
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 Any opposed, same sign. Hearing none, the motion carries unanimously. Next, as you know, at the beginning, we provide an opportunity for public participation as required by the Sunshine Act. To ensure the orderly progress of the meeting, all comments should be directed to myself and should be limited to no more than 3 minutes. Questions asked of the chair or the board may or may not be addressed at the meeting. So with that, with those parameters, I will go ahead and open it up for any public comment. All right, hearing none, we will just chug right along. Devin, I think you have a brief report for us before we move into enhanced premium tax credit discussion. So I will kick it over to you.
Great, thank you, and hello, everyone. So today we have a few key updates that we'll be walking through and an item at the end for discussion around the next steps on our plan simplification conversations, or future plan display as we've been referring to it recently. But just wanted to do a quick overview. So we're going to be talking about some of the implications for the enhanced premium tax credits, which we'll get into in just a minute, about the impact of what would happen if those were not extended after the end of 2025. We also wanted to provide an update on the state affordability program. There were some key occurrences on that happened with the budget process in July, and then a few different organizational updates on a few different topics. Before getting into the enhanced premium tax credit, I just wanted to do a quick check on our enrollment numbers and share a little bit about where we are with that. So for those who remember our number at the end of open enrollment, that was about 434,000. And wanted to note that we are sitting at about 437,000 now, and that fluctuates over the month and day to day, but we've been sitting pretty comfortably at about that number. So we have increased our enrollment since the end of open enrollment. That is attributable a lot to the continued high levels of account transfers that we've received from Medicaid. The unwinding process did officially end at the end of June. So we have started looking at what our normal Medicaid enrollment looks like on a month-to-month basis. And we continue to see enrollment and account transfers coming in under sort of more of that business as usual approach. So just wanted to provide an interim update on where we are with our enrollment numbers as we start getting closer into open enrollment, which is just a couple of months away. And we'll be giving a brief update on our planning for open enrollment as well later on in the discussion. So without further ado, we're going to jump into our topic on enhanced premium tax credits. So for those who likely recall, there were additional advanced premium tax credits put in place as a result of COVID, and those first went into place in 2021. So when Pennie launched, we had a couple of months without those enhanced premium tax credits, but then those were put in place middle of 2021 that provided richer benefits, not just to people who already received premium tax credits, but also to an expanded population, particularly those above 400% of the federal poverty level. Those enhanced premium tax credits were extended in 2022, and they are now slated to end at the end of 2025. So that may feel like a long time away, but what we learned from last time is that there are a lot of activities, as many of you know, that happen early on in the year in preparation for the next year's plan cycle. So we are doing a lot of work at this time to build out the impacts, to be able to communicate the impacts on consumers if those are not extended at the end of 2025. There have been a lot of conversations across different state-based marketplaces and with national associations about wanting to ensure and communicate that it's imperative that action is taken as early as possible in order to allow certainty for the market, for consumers, for our operational build, for our technical build, all of those components that get underway throughout 2025. So we wanted to talk through some of the data that we've put together to explain and provide an overview of the impact to consumers if these enhanced premium subsidies do expire. So we wanted to share some data that we've done, some new looks compared to the last time to really, again, communicate the impact. And then we have some discussion questions at the end of this portion to really see if there are other thoughts, ideas about how we can make sure that we're really capturing the impact completely, see if there's any other data points or examples or consumer stories that we can bring to bear to make sure that we are really conveying in a very clear way the impact on consumers. So I'll go through some of these high-level points on this slide, and then we have a few detailed slides that follow. So what we found that is about over $500 million annually is coming in to Pennsylvania consumers enrolled through Pennie due to these enhanced premium tax credits. And that accounts for about 1/5 of all premium tax credits that come into Pennsylvania annually to lower the cost of coverage. So that's a significant number, and we'll talk more about what that means on an individual level, but wanted to provide that top line to really characterize what a significant amount of funding this is that goes towards making coverage more affordable. Since the enhanced tax credits have become available, there have been certain areas where we've seen more enrollment, and that has occurred in low-income populations, pre-Medicare populations, really those in the ages 55 to 64, who oftentimes have some of the highest premiums due to age rating, young adult populations, and rural communities. These populations will be disproportionately impacted if the tax credits expire at the end of 2025. Across the board, though, for everyone who receives premium tax credits, removing the enhanced portion of that would cause premiums that people pay each month to go up by 81%. That's looking at their current plan today. If we removed the enhanced portion of that premium tax credit across the board, they would end up paying 81% more, or almost double. And another thing we wanted to look at was what portion of our current enrollees would really have not experienced anything different. So we've had about a 17% enrollment increase since we began in 2021. But the impact of people who've only experienced the enhanced tax credits is actually much greater than that. When we look at our data, we see that 2/3 of our current Pennie customers have only experienced enrollment that has had the enhanced premium tax credits. That means only about 1/3 of our current enrollees were enrolled in 2021 or earlier, where they have sort of had that direct impact of knowing that they used to pay more and now they're paying less. Everyone else has only paid the lower amount. And we think that's really compelling because of the concerns around sticker shock that people will have if after 2025, going into play in 2026, they are now paying potentially almost double what they pay today. So to look at this information and the data that we pulled in more detail, I'm going to have Jennifer walk through some of the more detailed data pulls that we did. Jennifer?
Thank you, Devin. Good afternoon, board. So as Devin mentioned, we're going to dive into some greater detail on impacted populations, showing some different data cuts to really emphasize the point that this is significant and it is going to harmfully impact all ranges of our populations of current enrollees. So our first look here is at the below 400% FPL population. This population is about 90% of our enrollees receiving APTCs. And just a reminder, these enrollees were receiving APTCs before ARP went into effect, and now they're receiving enhanced levels. So the graph in front of you is a per member per month net premium metrics comparison of looking at present day, what our enrollees are paying versus what they would be paying if these enhanced tax credits were to expire. And so you can see with the purple bars there broken out by FPL cohort, these customers do stand to face pretty significant increases, some as steep as 115% per member per month if those enhanced tax credits were no longer available. When you sum all of this up, you see that in the red bar there. So for the total less than 400% FPL population, they would be looking at, on average, a 76% premium increase if these tax credits were to expire. And then finally, the teal bar there is the 81% that Devin talked about, which takes into account all enrollees receiving APTCs. They're facing up to 81% premium increase on average. Are there any questions or comments on this slide?
Any questions from the group? I don't see any hands. Keep going, Jennifer.
Okay, moving to the next slide. So now we're solely looking at the above 400% FPL population. And just for context, 400% FPL for a family of 2 is about $82,000 a year. And for a family of 4, it's about $125,000 per year. So before ARP, this population was not eligible for any APTCs, and they were affected by the subsidy cliff. Now under ARP, they can only pay a maximum of 8.5% of their income towards coverage. And so 10% of our enrollees receiving APTCs are above 400% FPL, and they will see the largest cost increases. We are estimating, if we're looking at current enrollees and what they would be paying if these enhanced tax credits were to expire, they could see a monthly increase of up to $376 per enrollee, and that's per month. Or a family of 4 would see up to $1,500 more per month for coverage. As Devin mentioned, within the over 400% FPL population, the majority of these customers are pre-Medicare age, so within 55 to 64 years old. That's about 58% of these customers. And they are going to be hit the hardest in terms of seeing these cost increases. So what we've listed out here is two scenarios looking at the same couple, but in two different counties within Pennsylvania. And we're trying to show on an individual level what some of these enrollees could be facing if the enhanced tax credits were no longer available. So within scenario one, we have a married couple, 60 years old, non-smokers in Philadelphia County, and they are at 405% FPL, so just over that cliff. That's about $82,700 a year. Currently, they are maxed out at 8.5% of income, which is about $586 a month. However, without the enhanced premium tax credits, they could be facing up to $1,500 a month for coverage, which is about 23% of their income. And that's a 164% increase on this couple's net premium. When you look at this exact couple, but place them in York County, the results are even more severe. So that couple in York County could be facing monthly premiums of about $2,800 a month without the enhanced premium tax credits, which is about 41% of their income. And that's a 382% increase of their net premium. So, I mean, as you can see here, we talked about the 81% on the previous slides. That's an aggregate average. When you really delve into the individual impacts, it could be very severe. And, you know, people are going to have to be making decisions of whether they can afford 40% of their income towards just premium. Any questions or comments?
This is Antoinette. I just have a question. Are we able to do this by every county in Pennsylvania? I think it would be helpful as we have conversations at the federal level with different members.
We will get there, I think, in one of the next slides. Yep, absolutely.
I couldn't remember if it was there or not. All right, go ahead.
Yep, go ahead, Jennifer.
All right, next slide. I think to your question though, Antoinette, with those individual scenarios, we have the capability of doing that, and with a little bit more time can pull those scenarios per county. This map, what we're showing here is a county view, but it's looking at the average annual loss of APTCs per policy if the enhanced tax credits were to expire. So we want to look at the impact across counties within the Commonwealth. And typically when we show a map like this, you see kind of darker shading within the outer regions of the Commonwealth. But here what you see is a more substantial impact to the central corridor. And you know, we took this impact map and we overlaid on top of it a rural versus urban county distinction. We used a definition from the Center for Rural Pennsylvania. And you'll see here the yellow dots are rural counties and the teal dot is urban counties. And so if the enhanced tax credits were to expire, the counties within central Pennsylvania, which tend to be more rural counties, are going to be disproportionately impacted as compared to other counties within the Commonwealth. They stand to lose more dollars without those enhanced premium tax credits.
Any questions on this chart? Okay, Jennifer. Oh, wait, Colleen, did you have a question? Go ahead.
Not a question, I guess, but just a general comment. I would just say, I think this is pretty sobering, right? To look at what the impact will be for the consumer population, especially the stats that Devin was sharing as far as those that have, you know, gotten coverage over the last few years. And while some of these areas may be lighter purple than others, you know, that consumer, what it feels in their pocketbook is probably going to feel substantial no matter what, I guess. So just a general comment, you know, that I think this is concerning and, you know, I think should be a priority, you know, for all of us, you know, to ensure that we keep as many Pennsylvanians insured as possible.
Absolutely. Appreciate that. Anything else? Keep going, Jennifer.
And the final slide I have to present here is related to buying power. So in a world where there are less APTCs on the table, all enrollees are going to have diminished buying power. To your point, Colleen, it's the impacts are going to be felt across the Commonwealth. So this, though, is going to create a real setback for the gains that we've seen since our first open enrollment period. And we tried to quantify here, because we have some historical metrics now, tried to quantify the significant gains that we've seen. And, we can then leave it to an educated guess of customer behavior if the financial assistance is no longer on the table. So what we have here is looking at his historical view from our first open enrollment to our most recent one. 1 in 8 customers, or 12.5%, have shopped and enrolled in a richer benefits plan. And this does align with the overall trends that we've seen, where we're seeing higher enrollment in gold plans. That has increased 17 percentage points since our first open enrollment. And we've seen a decrease in the enrollment in bronze plans by about 4 percentage points. So again, with this enhanced financial assistance on the table, we see premiums being more affordable for individuals, and they are enrolling in these richer benefits plans, which also makes the out-of-pocket cost a bit more affordable. We also had a metric on here around affordability. So since our first open enrollment, the number of enrollees with monthly premiums under $10 a month has doubled. So again, it's just showing that people are able to buy up into these richer benefit plans because of these dollars. And as I mentioned at the start, if these tax credits are going to expire at the end of 2025, we do expect that we will see increased enrollment in less expensive plans or disenrollment altogether. As we mentioned 2 slides ago, if someone has to determine whether they can put 40% of their income towards a plan, it's a really difficult choice for someone to make. So that is, a bit of painting the picture from a data perspective and what we've seen of how substantial we think this impact will be. And we hope, this has quantified the problem and shown the severity, but we also want to then take it and evaluate, what can we do to prevent this from happening? And so I think that takes us to our next slide with you, Devin.
Thanks, Jennifer. Thanks so much for walking through those slides with the data. And I think another broader point that we've looked at a lot is really seeing how the enhanced APTC has created bridges between other coverage programs. So at the lower income levels, allowing for those $0 premiums through Pennie creates more of that smooth bridge from Medicaid to Pennie coverage. And then when you're looking at those older age populations, we really see that as a bridge to Medicare, that we see that as a way to make sure that people have consistent access to medical care at a time when, that's often when certain diseases or chronic conditions start emerging, and being able to manage those effectively before getting to Medicare. We see it as a bridge to Medicare as well. But as Jennifer mentioned, it is very sobering, and is, to use Colleen's word, and concerning about the impact on enrollment we could potentially see. We've made a lot of gains. We've had 17% increase in enrollment since 2021, record levels for the marketplace. So, thinking through how to prevent that from happening is really what we're trying to prepare for. And we think a lot of that is through education on really 2 fronts. One, education about how we really very clearly tell the impact and the stories of what this would mean for our consumers that we cover through Pennie, and then also education on the timeline. I think what we've heard, since this really is subject to congressional action, we've heard anything from, there might be a short window at the end of this year for a short-term extension, or it might be something that gets pushed all the way to August of next year. And I think what kind of focusing on 2 fronts of education with broader audiences is the significant impact it's going to have on consumers, and the imperative for action earlier rather than later. Sometimes people see it extending in with other tax credits, that if they extend on December 31st, 2025, and you extend them at that time, there's not much of an impact. But this is very different, to avoid impacts on consumers, on open enrollment, on market, and all the other pieces. It's really imperative, we think, to try to educate about the importance of extending those tax credits as early as possible. ideally at the end of this year, early next year, but even after that, sort of every month that we can gain as far as being able to prepare is really important. So we have some discussion questions here that we just, wanted to see if folks have feedback on about the customer impact, if there's other thoughts on ideas that we can look at to, again, really clearly communicate the impact on consumers, both from anecdotal or consumer stories and also the financial impact. And also interested in understanding if there's other activities and kind of syncing up with other activities, or if there's anything we can provide to support educational conversations that any organizations are having with broader audiences. So open it up now just to see if there are thoughts, ideas in this area. I think it's one of those sort of the more kind of all hands on deck type approach, the more successful we could be with this.
Yeah, Devin, before I kind of speak to that, I did have a question. I know we said 12% come back shop and buy something else. Do we know what percentage of people don't access their account? They get auto renewed. They know they're going to get auto renewed, so they don't even come back and look at it at all.
We could definitely pull numbers on that. I
'Cause
would
I'm
say
just curious how many people, like, there is going to be a not insignificant population that doesn't even recognize it until, and I know the companies, they'll get their premium increase notices, etc., but maybe they don't look at it, they don't see it, they won't feel it until that first invoice comes due. So I mean, the potential when you see rate increases like that is for kind of significant movement within the market once the policy is actually being built. It's just an interesting dynamic, I think, that we should be cognizant of as it gets closer.
and I don't have the exact number off the top of my head, but I believe from last open enrollment, it was between 60 and 70% that of people who are enrolled who just continue with their plan moving forward to the next year and don't come back to make a change. But we can get a specific number on that.
Some amount of those people, they got the notice, they saw it, they just accept, they like their plan, they're going to keep it, they're going to pay the premium increase. But I think there will be a block of individuals that just don't know until that happens. So, I mean, I think that's, if we have to get there, I think it'll be incumbent on us from a messaging standpoint. But I think the hope remains that we don't get there. The NAIC and commissioners had a fly-in in May that I participated in DC, and at each one of those meetings, I raised the concern about expiring ARPA credits. So it's something that insurance commissioners have been papering Congress about the importance of continuing these. And certainly we have done this in the past jointly with Pennie. PID and Pennie wrote a letter the last time that it almost expired, and certainly we can continue those conversations on getting a similar letter up for review to drive that point home, because I think the point that Antoinette made earlier, I think is a really important one. At all of the meetings, I mean, the members want to know how it impacts their constituencies, and that's the chart that I had the last time that we did this a couple of years ago in those meetings. And I mean, it really is an eye opener just how much these premiums could be increasing. So certainly appreciate that piece. But want to open it up to anybody that has either a question or thoughts on their own next steps, what you may be hearing from your trade associations. Just open it up for discussion.
This is Antoinette. I'll jump in. I think what we're in the process of doing right now is creating a storybook with stories from every congressional district across Pennsylvania from individuals who will be impacted. You know, our GR team's been meeting with members, and I think after the election, our plan is to actually get constituents in those districts who will be impacted to sit down with ledge staff or members where possible to talk about this. You know, we're going to do some town halls. You know, we'll reach out to you, Devin, and Commissioner, to hopefully have you guys participate in that to try and really up the kind of public engagement in this, as well as shape the narrative for folks that aren't thinking about this. And this data is very helpful. Our team has been asking for data like this, so I think it's perfect timing as we have those conversations. And we did a sign-on letter the last time with a bunch of consumer organizations and some trade organizations. Motivate coalition partners to weigh in with members as well.
That's great. Thanks, Antoinette. Other thoughts? And as people are thinking about them, I think one point that we've tried to I would say softly address, Devin, is that timing really matters. The health insurers on this call know that rates and forms are usually due in the May timeframe. And if we don't know by May, that means we have to look at options like filing 2 sets of rates, amending rates later on, closer to the effective dates, and that becomes an operational challenge, I think, for everyone. So recognizing that we did it last minute-ish the last time, I think guidance ended up happening, July, August, September, and everyone had to rush after getting 2 sets of rates. It just was not an efficient way to do it. It would provide much more clarity if they were to do it this fall and the spring, as we head into rate filing season already for 2026. So something to keep in mind as we continue to have those conversations. Anyone else? Colleen.
Yes, so obviously Independence Blue Cross, part of the Blue system. I would just say the association did reach out to Blue plans, asking for their prioritization of legislative issues. This was something that we pushed to the top of our list, so that we are ensuring not just here locally, but also from a national perspective, that this issue is being brought to the forefront, and we are advocating for the continuance of this. So trying to do what we can from a local grassroots perspective here with our legislative contacts, but also leveraging the association as well.
Thanks. Tia.
So in response to the first question, what are some different ways to show the customer impact? The Pennie awareness campaign may need to switch focus. One, continuing to let folks know what Pennie is and what's available, but what is coming down the pike. As far as the financial impact, our organizations have the ability to speak directly to those who are covered under Pennie plans and really raise awareness internally. So we have that data available. We're able to leverage that. So.
Great. Thanks, Tia. Anyone else? Okay. I think, Devin, we will continue moving right along the agenda. We're pretty much right on schedule, so let's roll right into a discussion about the affordability program.
Great. So last time we met in May, we were there were a lot of discussions underway about whether we would be able to have a state subsidy or not for this plan year. So the last time we talked, we really focused on what type of model we would want to pursue for a state subsidy if it were to happen for this year. And then since that time, the budget process occurred, and we do have progress on that front. So as part of the 24-2025 state budget, the fiscal code was amended to allow for the creation of a state health insurance exchange affordability program. Technically, in the law, it said it could start as early as 2025, contingent on funding provided through the General Assembly or through an account dedicated and identified in that code language. To be clear, there is not funding at this point for 2025. So this program would be available through Pennie, and it would be the purpose to incentivize enrollment by providing financial assistance to people purchasing coverage through the exchange. The new program did specify that it would be financial assistance for people between 151 and 300% of the federal poverty level, or lower if the enhanced tax credits are not extended, and are targeted towards silver and gold plans, not bronze plans. That's consistent with the proposal that we had in May. So really kind of aligns to those parameters that we discussed at that time. Again, so the legislation identified two potential funding mechanisms. One, a disbursement from the Joint Underwriters Association, not to exceed 50 million, which was, again, roughly the amount that we were sort of anchoring our modeling towards, or an appropriation from the General Assembly. But again, no funding is available at this time for 2025. The Joint Underwriters Association funding is not available, and there was no specific appropriation from the General Assembly. Any questions on the overall parameters of the affordability program before we go into some other updates on that? Yes, Colleen.
Sorry, just on the comment that there's no funding available at this time. If you were to find the funding, is there a chance that this would be implemented mid-year, retroactively to January 1st? Like, what are the, I guess, possibilities of anything? Or is this something where it's like there's no funding for 25, so we really would be like pivoting to figuring out the funding, implementing for 26?
At this point, we are really looking for as if something would potentially happen for 2026 to start the plan for 2026, so to be available through open enrollment next year. I think if new information becomes available, I think we would, maybe want to have a discussion about what that means, but it is so incredibly complex, as many people know, to implement something new like this. So our intention really is to look for next open enrollment for the 2026 year to see if we are able to secure funding for that year.
Agreed. Okay, that was our concern too. When I read the slides, just the pre-read, that was kind of the way that at this time, we just kind of was like, well, if we were to find it, because I think it is complex to kind of implement mid-year, especially if we would consider anything retroactively. So I appreciate that. Thank you.
Any other questions on this piece? Or Devin, you had a couple more comments you wanted to make, I think. We'll just keep going and then hold questions till the end of this piece.
Yep. So also part of the reason that we had the conversation in May was to be able to start laying the groundwork from a technical and operational perspective, should it move forward. So we wanted to provide an update on those conversations, including conversations that we had with insurers. So to have this conversation, I'm going to turn it over to Rob Schober, our operations director.
Right. Thanks, Devin. So as you mentioned, basically, and as Colleen asked towards, we don't currently have funding. We have been in preparation, though, to build this for open enrollment 2025. So basically, we're looking for the earliest possible deployment now that we have statutory authority. So we have begun work on getting the system functionality built, and we are hoping to continue that build, deploy it, and then continue with our testing needs to ensure that we are ready for, if we do get funding for 2026, we could do a smooth rollout and implementation. So where we currently stand is the functionality that is needed for this state subsidy will be deployed to our platform in late September. It will not be turned on, obviously, but it is configurable. So we could choose when we turn it on, when we have that funding become available. There are two key components that we still need to work through after that deployment. And the first and foremost is working with the insurers to get ready to prepare them to test the required changes that their systems need so that they could really do these 3 bullet points here. So the first is ingest and process the 834 files, which will now, once this is turned on, reflect additional savings. So instead of just having the APTC columns, it would actually reflect the information for the state subsidy amounts as well. The second is also the insurers would need to be able to reconcile that net premium. So in their systems, they would need to make sure that they are not just deriving the net premium based off of the gross premium with a subtracted APTC amount, but that they're also including the state subsidy so that the net premium would reflect both different types of financial savings. And then the third bullet point here speaks to kind of billing and invoices. So we would like that the state subsidy amount be displayed on the billing and invoices so that the consumers are aware and to eliminate some confusion. So specifically, If a consumer, they have to reconcile APTC at the end of a year. If we do turn on state subsidy when we get the funding, at that point, we wouldn't want the consumer confused thinking that they should reconcile the state subsidy amount on their federal tax return. So really delineating out the difference between the different financial assistances is beneficial to our consumers. The second key step that we have to ensuring a proper rollout once we do get state funding is testing. So the final 2 bullet points on this slide speak to it. These are 2 concurrent testing plans that we would undertake. First would be that internally we would ensure that our system functionality works properly. So we would be doing this in spring or summer of 2025. That's really internal Pennie testing, making sure that everything looks like it should if the system were to be turned on. The second is actually conducting the testing with the insurers themselves. So we use a different testing environment. We send 834s, like token 834s that are based off test cases, to the insurers. We make sure that they're able to ingest, process, and display the state subsidy information. And for that specific testing for the insurers, we're really targeting a spring test plan. Right now, it's looking like we're trying to slate between the beginning of April and the middle of May. So it's about a 6-week test plan that we're looking towards. We do have to have all the insurers kind of testing at the exact same time because there are system requirements where we have to, time travel or jump a date forward to make sure that it's properly ingesting and processing those 834s with the state subsidy information. On the next few slides, we have some examples of how the state subsidy is actually going to display in the system. So next slide, please. So we have picked 4 for today just to go over quickly, but we also have an additional 4 in the appendix if anyone's interested in looking at those. It's worth noting that the name that we're using in the screenshots is just a placeholder. That is not the final name. It's also worth noting that there is, our vendor has another exchange that already has implemented a state subsidy. That's why we're able to so easily pull these screenshots. So these are how they kind of currently display, obviously with a name change, in another exchange. So on the next slide, you will see first and foremost the anonymous shopping. So this is when a consumer enters information like their household income, their family size, their zip code. And why they do that is they're trying to receive an estimate of how much savings they might have. You can see that there's a clear delineation between, at the top it says lower premium, monthly premium, that's the APTC amount that the consumer would be eligible for. And then at the bottom, there's the PA health plan savings, which is our placeholder name, or the state subsidy. So we have a clear delineation showing you how much you would receive in APTC as well as state subsidy if you're eligible for that. On the next slide, we have what the enrollment dashboard would look like. So this is when a consumer is in their enrollment dashboard, they can actually see the breakdown between APTC as well as the state subsidy. And you can see that at the bottom circled in red. On the next slide, we have the plan shopping tile. Now this is a little more interesting. So this is when someone's browsing to see what plan they would like to select to enroll in. The state subsidy does not automatically display on the tile. What is displayed is the total savings amount. So you'll see that $694.39 is displayed. There is a hover over option though. So if the consumer were to scroll over that, they would then see the breakdown. So federal would be the APTC amount, PA savings would be the state subsidy amount, and then their total savings shows what their total financial savings is. And that's reflected obviously above in the total savings where the little arrow, the little finger is pointing from the cursor. And then also that's reflected obviously in what the net premium amount is. In this example, it'd be $0 per month. And then the final screenshot that we have pertains to the insurer enrollment portal. So on this screen, you would see that it breaks down the APTC amount versus the state subsidy amount. So you can see that on the left where you have the premium amount, the elected APTC, and then the state subsidy amount, leaving a net premium amount. Additionally, it does provide in the premium grid, it shows a breakdown month by month, APTC amount versus state subsidy amount. So those are the screenshots that we're going to display today. Again, we do have additional ones in the appendix if anyone is interested in seeing more about this. But does anyone have any questions at all pertaining to where we stand with state subsidy?
Alexis.
Yeah, thank you. I guess, what is the plan to secure the funding? So I think we're being asked to build these capabilities with the assumption that funding will be there for the next OEP. And I understand getting ahead of the build cycle, but I guess I want to understand that more. And then in particular, I do worry, I think we all want to extend that federal subsidy. I worry about the effectiveness of the state subsidy if the federal subsidy no longer exists. But, you know, maybe that's where we suspend our disbelief and say, we're going to get that, but there should probably be some almost sensitivity analysis to say if the federal subsidy is only partially funded going forward, what will that mean to, you know, the incremental effectiveness of layering on that state subsidy? But I know I said like three things. I'll go back to the what are we thinking about the funding source for the state subsidy?
So I think, you know, I definitely hear the point that it, without certainty on the timing at this point, which we don't have. I think the one source identified, the Joint Underwriters Association, you know, the timing is not clear there. I think the intent that we have is to make sure that we are ready and prepared. One of the pieces of feedback we got over the past couple of months in having conversations with the insurers is really just understanding how long of a lead time is needed to make some of these important changes. And so we want to make sure that we are in a good position to move forward when funding is available.
Yeah, I don't have much to add to Devin's comment other than, I mean, it's an authorized program and now the idea is how to get it funded. So we'll have to see how those conversations continue through the legislative process. But certainly, I think from a Pennie perspective, wanted to make sure that we are ready because I don't know that it wouldn't have been a challenging process based on what I understand from this presentation today. This year, had it gone live, would have been a lot of manual processes for the insurers and Pennie, and certainly would want that to be more streamlined and simplified for every party. Should we be able to get this off the ground for 26?
Yeah. When would you think you'd be able to get sort of requirements? And I know we've got a bit of a template to build from, but requirements to us so we can see exactly what it would take to build this internally to be ready for that April test cycle.
Yeah, so the requirements are really those general 3 bullet points in the beginning. Understanding that each insurer would have a different system functionality. It's kind of predicated on what your system looks like in terms of how you would be able to ingest the 834 files. How the 834 comes across, it's actually going to reflect identically to how APTC is actually currently displayed. So instead of it just being a certain amount of columns that are left for APTC, there'll also be that basically copied so that there's 2 different columns. There's going to be information for APTC and then information for state subsidy, but they're the exact same fields and displays as APTC is. And then it would really depend on each insurer's system functionality for how they could properly ingest that if they have to do reconciliation processes before they could populate like a billing notice or anything like that, would be dependent on what the insurer's actual system solution is.
Mm-hmm.
And Rob, we've been sharing one-on-one with insurers additional information, right, with the operational teams that we work with about kind of the next layer down and even, you know, some troubleshooting with them on some of these areas as well, right?
Yes, and we could also, at any time, we could set up a call with our EDI expert and walk through what it ultimately entails. We're really just trying to target that spring deployment just so that it would be easier if we had everyone, you know, ready in the same training plan or testing plan. But yes, we could definitely help provide any technical assistance that's necessary in the interim.
And then Alexis, on your last question about the enhanced APTC, I think, you know, and we've talked about this with the state subsidy as well, that unfortunately the state subsidy is only a portion, would only sort of be able to compensate for any lack of enhanced subsidies in a fairly minimal way, just because of the respective sizes, you know, thinking back to that $500 million number. But I think there is some acknowledgement of that in the fiscal code. There was a adjustment to the FPL ranges that the state subsidy would focus on if the enhanced subsidies went away sort of acknowledging that there wouldn't be that $0 plan available under 150% that there is today. And I think what would mean for us is sort of to remodel out the state subsidy to determine how most effectively to allocate that money if the enhanced subsidies were not in place. So I think when we get further into those discussions and gauging any signals we're getting from the federal side, sort of having contingencies or modeling out 2 different scenarios, things like that, I envision would be conversations we'd have to have early next year.
Okay, thank you.
Yeah, Devin, in most of the conversations I've had, I've tried to drive that point home that, I mean, any Pennsylvania subsidy is dwarfed by the ARPA subsidy, such that if the ARPA subsidy goes away, I mean, I think you're talking about tens, if not 100,000 people that will lose affordable coverage. And that is really significant that while we may be able to mitigate some of that loss, I would expect more uninsureds. I would expect far fewer enrollees through Pennie if we lose the ARPA subsidies. I don't see how that's there's any question because of the affordability, making insurance so much more accessible to more people today than it was 5, 6, 7 years ago. So we got to continue to drive that point home to continue to hopefully get the ARPA subsidies extended in some way. Other questions about the subsidy wrap or enhanced affordability program and kind of the technology behind it? All right, not seeing any other hands. Devin, I think you could continue rolling.
Great. So we have a number of organizational updates. So we're going to do a quick update on unwinding, some open enrollment prep activities, and some preliminary budget updates that we wanted to provide in advance of the full budget discussion in October. So to cover some of the unwinding information we wanted to share, I'm going to turn it over to Jennifer Lloyd, our special advisor.
Thank you, Devin. So what we have here, some top takeaways on Medicaid unwinding. We also have more detailed data slides found in the appendix. If anyone has any questions on those, we can take those here as well. But just a quick note. So DHS's redetermination process for these recipients did conclude at the end of June. Because of our 120-day loss of medical assistance SEP, the June cohort still has until the end of October to enroll. So these numbers that we're sharing here with you are as of July 1, but we will need a little bit more time for that run out before we can give our final reporting on how this event went. But so far, what we are calculating is throughout the unwinding period, total enrollment has exceeded 84,500 enrollees. And that's about an 18% conversion rate from the applicants that we are receiving. In the appendix, we have a map slide, which shows where those enrollments are coming from and county level conversion rates. But overall, we're seeing enrollment patterns that align closely with our uninsured population disbursements, as well as some of the enrollment patterns that we see at the end of OEPs typically. So more highly concentrated in southeastern PA and also western PA with Philadelphia and Allegheny counties. We also wanted to touch on one of the processes that we brought to you all a couple years back, which is the auto eligibility process. So we were trying to look for ways to create a more seamless enrollment process for individuals coming from DHS to Pennie. And what the auto eligibility functionality does is when we receive that account transfer, it automatically creates an account and creates an application for the individual, as well as runs an estimated eligibility determination and sends a notice to them without any customer action. So it's reducing steps in the enrollment process, as well as getting more information into their hands as soon as possible around what they could potentially be eligible for. And we've seen this be a very successful process throughout unwinding. 74% of our account transfers were eligible to go through this process. And it's also our largest generator of enrollments as a vehicle for enrolling. We do have more information in the appendix around other enrollment vehicles that people use to get enrolled with Pennie coverage. And then just a couple of high-level financial assistance stats. So we have, for this unwinding period, these enrollees, 97% of them are eligible for financial assistance. And we are then seeing that in cost metrics, their affordability. So 23% of the current unwinding enrollees are paying less than $1 for coverage, and 56% are paying less than $50 for coverage. So their coverage is a bit more affordable than when you look at the total Pennie enrollee population. So as I mentioned, we're going to continue to support the enrollment of these individuals through the final 120-day SEP at the end of October. And then we also have open enrollment kicking right up there in November. And anyone who wants to come in for plan year 2025, we would support that as well. Are there any questions on?
Yeah, this is Cheryl. Do you know how this compares to what we projected, what the numbers would be?
So I would have to go back and check. I don't think we ever published any projections. We had some, internal estimates. It was just very challenging because we had no historical understanding of conversion rates that we could expect from DHS. But I would say the 18% is within the ballpark that we had projected internally. And when you look across other state exchanges as well, we're right in that mix. So it's not any less than what we expected, but I don't think we ever published any projections there.
Thanks.
Other questions for Jennifer on the unwind? Amy?
Thanks, Jennifer. This is really helpful in this, as are the appendices. Is it possible, and not right now, but to get a breakdown by age of how, of people who transitioned and where they wound up, what level plans?
Yes. Yes, we can work on that. It'll, when we're looking at age, especially over the course of the unwinding period crossing plan years, we do have to take like a current enrollees. And so, we can take a look at that. Just take a little bit more time to pull.
Okay, thank you.
Mm-hmm.
Anybody else? No? Jennifer, you can keep going.
I think I'm handing it back to Devin.
Okay, we will do that. Devin, you're
All right.
back.
All right, great. So the next two are really kind of forecasts of topics that we're going to go into deeper dives in October. Wanted to provide at least a preliminary view into our thinking behind open enrollment readiness. And then the next topic is on the budget for the following year. So our board meeting is October 24th, so it'll be right before open enrollment starts. So wanted to give at least a preview into our open enrollment strategy. We are really focusing on two areas like we did last year. One is retaining existing consumers and making sure they have a really smooth auto renewal experience, making sure they have clear communication about next steps, doing all the outreach to any people who fall out of auto renewal. Similar to last year, taking some of those lessons learned, looking at what was effective and continuing that. And really pursuing a full-blown outbound communication approach where we take every channel we can in order to reach consumers and make sure they stay enrolled for the next year. One thing I'll note on texting is that we had special authority to do kind of blanket texting for unwinding individuals coming in. Our texting capabilities moving forward will really be focused on people who have affirmatively consented to texting in the Pennie application. So that will mean a slightly different approach there, but we think that'll still be an effective means of communicating to individuals who have done that to make sure to remind them if their eligibility is changing, to reach out in open enrollment around deadlines and different key pieces. We were very selective in how we did that last year, and we are planning to continue that communication as well. The other key category that we focus on is growth, really looking at where are the uninsured still and how can we reach them. Last year, we talked about efforts to, as part of that, to find brokers that are diverse and reflect different communities, and making sure that we have, between our brokers and our assisters, really full coverage across Pennsylvania of making sure that people have someone they can go to in person to get support. So we're looking at expanding that last year for the broker recruitment and diversification project. We had really sort of focused our attention on some specific areas in the Philadelphia region because of that high uninsured population. And we're expanding that slightly geographically to see if we can continue to expand, again, the opportunities that people have to find in-person help. We also, based on data, are still looking at a lot of the uninsured being in the Southeast region. We took some really focused tactics last year with our marketing and outreach, and are intending to have similar approaches this year, but also kind of expanding a bit more in that region, and also anchoring with some additional outreach in the West as well, in the Pittsburgh region. So, taking our lessons learned from last year, continuing to do what we thought was effective. We did see higher enrollment rates in the Philadelphia region because that we do attribute in part to that extra outreach and those additional tactics. So, looking to continue to gain momentum in that area. Two new implementations that we're just going to have additional focus on this year because they are different than last year. We mentioned in the May meeting, I believe, that the failure to reconcile approach will be has been reinforced from the CMS perspective. So what this means is that people who received advanced premium tax credits in the past, they are required to, when they file their federal taxes, report how much they received and either pay back any extra based on income or get more. That is a requirement for people who receive APTC, and if they do not include that in their taxes, then the exchange is required to stop providing that financial help moving forward. This was a normal part of exchange business prior to COVID, but because of, for a variety of reasons, including backlogs at the IRS, this was put on hold. People still were required to file and reconcile their taxes, but that extra piece on the end about removing the financial help moving forward, if they didn't, was put on hold. That now is no longer on hold. So this will be the first time that Pennie is doing this. So we have really focused on making sure that for anyone in this scenario who may not have filed their taxes in the past, sort of knows what next steps to take, whether to amend their taxes and tell us about that so that we can reapply financial help moving forward. We did meet with a group of assisters that was very helpful to think about how we make this language very clear to consumers, make it accessible. It is not everyone's favorite topic to talk about taxes and in coordination with their insurance. So we wanted to make sure that we were really getting all the feedback we could to make sure that language was clear and concise to consumers. So this is one area that, there might be people, and this happens during open enrollment, where if we find that they've not filed those taxes and reconciled them, that this would be the open enrollment where we would remove that APTC moving forward. It is applied to the last 2 years, so someone would have to have missed both years of filing those taxes in order to have the removal of the APTC.
Dr. Conti, you had a question?
Yeah, do we know about percentage of folks that will be affected by this, and what's the plan? You talked about you're going to communicate with those individuals. Is that written communication, outreach? What does that look like?
So we don't have a great estimate of this because we have not taken the step to remove APTC in the past. And also there have been a lot of new people to the exchange. I think, judging from experiences with past exchanges, it's usually not significant. I mean, it is significant for people who it impacts, but, I think some others in the past have seen it, sub 10%, and some even as low as 1 or 2%. I think where we fall on that, we're really just not sure because we've had a lot of new people to Pennie. This hasn't been a process that's been enforced for a couple of years, so that number could be higher than that, but we really don't have a great sense. We will know and Rob, correct me if I'm wrong, we will know a preliminary estimate by early September. So we will know in far enough in advance to be able to do more active communication to people if that number is bigger, even ramp up that communication. Rob, did I get that right?
Yes, we should know at the early stages of our auto renewal process. So we're looking at probably the first week of September. We should have a definitive number.
Thanks.
Other questions about failure to reconcile piece? Okay, I know you had one more implementation, Devin.
And the second one is the deferred action for childhood arrivals, or the DACA population. Under federal rules, they are now eligible to receive advanced premium tax credits. They were not before, but due to that rule change, they are now for this open enrollment period. Based on estimates, we think this is a fairly small population in Pennsylvania, under 2,000 that might meet this criteria, and of them, some subset of that might be uninsured and therefore eligible. So we're making the necessary changes to allow this population to enroll through Pennie for this open enrollment period. Again, not expecting it to have a significant impact from a volume perspective, but an important change that we will be prepared for this open enrollment.
Okay, questions on DACA? Nope. All right, Devin.
This slide just shows the open enrollment readiness activities and where we are in that process. I'm not going to go through all of it, but just wanted to have it here as a resource, very similar to prior years, and we're tracking right along with all of our open enrollment activities. So on the next slide, I'm going to switch gears a little bit, but again, this is also sort of a conversation we wanted to start now in anticipation of the full budget conversation in October.
Devin, can you go back one slide
Yes.
for a second
Yeah.
to the timeline? Just want to make sure there were no questions about kind of how the schedule plays out. Anybody questions here? No, seeing none, that's enough time to review each month, Devin. We'll keep going.
Great. All right, so we have been doing a lot of thinking on our budget. We are entering into year 5 of Pennie operations, and so we took a fresh look at the budget and wanted to talk through a change we're planning to make and looking for feedback on between now and October. But before I get into that, just wanted to mention that through Q2, revenue streams are consistent. We're 10% above expected, and because of that really healthy enrollment that we're seeing, and expenditures are slightly under budget. So we are in a very positive position now. We did issue the 2023 reinsurance contribution, about 29 million. We had budgeted, I think, about 40 million for that. So that was also under what we were expecting. So for those reasons, our financial positioning is very strong, as it has been for the past couple of years. So with that strength that we have, and we on the next slide getting into really a change in approach of how we are thinking about ensuring sort of long-term viability of our budget, and making sure we have all the necessary contingencies in place to make sure that we're sustainable and viable across all of our different aspects and our different programs. So we have, over the years, we've developed a really strong understanding of our revenue and generation from user fees, from enrollment, and being able to predict that, as well as a better understanding and detailed understanding of our costs related to our operations. And as some of you recall from last year, we have also in the meantime accrued a substantial year-to-year carryover due to a unique combination of factors. So because of ARPA, COVID factors, enrollment across the board has been higher than original projections, which has increased the user fees. And also there have been, again, because of sort of the market changes with COVID and some of the different factors, lower than expected reinsurance payments. A lot of those differences were really, unique situations happening year to year that have sort of resulted in more revenue than costs, and creating a year-to-year carryover. That carryover is not fully replenishing, right? There are some sort of big infusions into that once we that are not sort of continuously growing, that are sort of due to some of these year-to-year nuances. So we do feel like we are in, strong position from the user fee funding and from the cost perspective. And we also, are unique as an independent agency in that we are fully self-funded. We don't have other funding mechanisms coming in for our operations and for reinsurance. And, we've talked about the state subsidy component. So we think that we're at the point in maturity of our organization that we should establish operational reserves or sort of rainy day funds for each of these areas. And that's really to ensure long-term viability and protect against unforeseen circumstances in the future and allow us to have more protection from any shifts. We've been fortunate in that any shifts we've seen up to this point have gone in the way of providing us with more funding, but some of these dynamics that are unpredictable could in the future go the other way and result in exceeding our budget. So we want to make sure that we're in a very strong footing for that. For example, if the enhanced premium tax credits are not extended, that would have an impact on our user fees and our operating funds. So, by having funds set aside, we'd be able to, use that to be able to sort of even out after that to adjust to any enrollment changes that occur. So on the next slide, kind of break out what we're thinking about doing. And again, this is not for being proposed for vote or anything today. This is really to indicate where we're wanting to head and really wanting to get feedback over the next month or two to make sure if there are questions or concerns here that we can work those into the October budget. So historically, we've had two distinct buckets of expenditures related to our operations and personnel and the reinsurance contribution that we make. And then moving forward, we expect there to be an additional one for the state subsidy. So for each of these three areas, what we'd like to do is to create an operational reserve dedicated to each one using kind of industry standards of setting aside around 50% of the annual budget of those areas as sort of the rainy day contingency fund. So what that would mean for the operational personnel contingency would be about 30 million. The reinsurance would be about 20 million and state subsidy would be about 25. This would allow Pennie again to set aside funding in each of those areas. For example, with the if there's significant enrollment changes downward due to enhanced APTC not being fully extended, that might be an area where we draw some of that to kind of even us out for a couple of years. On the reinsurance side, if there's some factor unforeseen, we all lived through COVID that kind of works the other way where it exceeds what we budgeted, that would be a time where we would dip into this contingency fund. And then the state subsidy, when it's funded, we would model conservatively to try to make sure we have buffer, but just in case there was a scenario, especially in the first couple of years, where, if enrollment exceeded what expectations, even conservative ones, we would still want to make sure that we had contingency set aside to be able to meet that obligation. So then we could, readjust and recalibrate the next year. So with these set asides, it would still allow Pennie to have positive net income each year, and it would allow us still to have about 5% of the operating budget to allocate to special project funding. So it would not sort of freeze us where we are. We would still have funds to continue growing and continue to reinvest in the Pennie program, while also sort of setting aside these rainy day funds, these contingency funds, to make sure that we really are setting ourselves up for success in the long term. The next slide just has a couple of high points around kind of how the operational reserves would work and kind of some of the definitions. I've talked through a few of these. Again, really just using it as a set aside. We determine the amount by really looking at, 6 months or 50% of each program's total. And that's an industry standard we were working from. And then the idea would be in October, if this, if we can if we end up setting these more in lockstep, that would be part of the October conversation where the operational reserves would be reflected in the equity section of the budget. And so it really wouldn't change too much about how Pennie operates, again, because we do have a very strong financial position. So we're still able to grow and maintain our operations, even with these set asides. So anyways, I wanted to talk through kind of the thinking there and what we would like to have as part of the October budget the fulsome picture. We'll see all of that work together, but wanted to kind of preview that. And if there are questions, concerns today, or even over the coming weeks, we wanted to make sure we had provided an opportunity for feedback on that before October. That's Alexis.
Yeah, I mean, how do I think about either user fees contributing to that excess being too high versus the need to build the reserve? So I just, will we, so if you build this reserve, then you're going to want to fund it to the reserve level all the time. So if you use it in a rainy day, you're going to want to, I don't know. How do you then keep the reserve level sufficient? And I worry that we are mixing operational reserves with other types of reserves, we'll say. Like, I look at reinsurance and state subsidy reserve differently than an operational. I don't, so when we compare this to other states, what components did those states have, what components of reserve did those states use? I don't know if my other insurers or other folks on the phone have similar questions. Like, there's just feels like we're mixing a couple of concepts here.
To answer your first question, a lot of the carryover is not necessarily from the revenue exceeding the cost. It's from these sort of one-time, or, like, I think there was one year when reinsurance was significantly lower, and that gap or that difference is just sort of, we've been carrying that. If you recall from our budget last year, the difference between the revenue and the costs, the net difference was about $4 million, which is, I would say, a safe amount to invest the next year, versus sort of these one-time infusions of 10 million or pieces like that have really kind of been more year-specific pieces. So they're not regenerating like a user fee would, if that makes sense. Like, those are sort of the amalgamation of a couple of unique years, such that, we can't spend that down and expect that amount to replenish the next year, which is why we thought it would be appropriate to kind of allocate that over into to reserve funds instead.
Okay, so there would be so let's say that we set aside this reserve, and I'll just use an extreme case, and there wasn't a funding source identified at all for the state subsidy in 2026. But our subsidies got extended, and we said, yeah, it would still be useful to have that state subsidy in place. You would tap into 25 million sitting here and then not expect to rebuild it?
No, we can't do that. We can't just
Okay.
tap into Pennie money to fund the subsidy wrap as it was drafted. Devin, I'm
So
sorry,
then how do I
go on.
think about it being labeled that way? So I must be misunderstanding.
So I think that the intention was to have it as like, in case it went over, but not to fund a state subsidy. So it'd be if we had the 50 million and because of enrollment, it ended up at 51 million, we'd be able to draw from that to handle that and then recalibrate for the following year. I think of it as like a recalibration buffer. So if enrollment changes significantly and our user fees go down a lot, and then we sort of have a buffer to use in that year or two following that to, recalibrate our operating costs and make necessary adjustments for sort of a new normal. So I guess I think about it kind of in that way of it buys us time to adjust if we think it's a permanent change, like enrollment's always going to be lower because the enhanced subsidies aren't there, versus like a one-time 1 year change that we don't think is going to happen again. And in that case, we wouldn't necessarily have to recalibrate everything as much as we would just need to make sure that that year was covered.
Can I just ask a follow? How can we use that money if we go over on the subsidy if we're not allowed to use penny money for the subsidy? So I'm just curious. Am I not understanding it correctly?
I think
So
the
I think we probably could, but there is no program until that money is authorized and allocated in the first place. But if there's that program at $50 million and we need to go up to $52 million, I think we could potentially use the $2 million that would now be in a rainy day fund to supplement what was appropriated for the program. It's just we couldn't rely solely on penny funds when there isn't another appropriation that has been made. Devin, is that how you were thinking about it?
right, yeah, because 25 million wouldn't be enough. It would be 1 year and then it'd be gone. It's not a replenishing. So it would be there if it was funded fully through the mechanisms, but there was an overage. And I think, perhaps that's something we can clarify, but I think the question was that we could use a reserve to, adjust versus having to take other actions to either hold back the subsidy or try to get more funding for it.
Other questions on kind of the structure of the contingencies? And I think part of it, Devin, that's worth kind of going over again was the piece that, I mean, we're at the significant reserve in large part because of COVID and ARPA and how the federal government changed the calculation with the pass-through funding during COVID that ended up with Penny only giving, I think, $18-19 million to the reinsurance program when that year we would have expected it to be almost double that, coupled with kind of the reinsurance modeling tending to be more on the conservative side. So it's really just a year or two that is the significant reason behind the large carryover reserve. It's not year over year that Penny is making significant amounts of money above what we're budgeted for operations. It's just that aberration years early on in the Penny program. And I think part of that difference in the conservative modeling also bears itself out with the announcement PID made, what was it, last week, in increasing the state contribution towards the reinsurance program. I mean, we jumped up the co-insurance from 50 to 60% because we have been more conservative, and the modeling has been saving money more than it has been used what we expected to use. So kind of that's the increase in the ask for Penny in the future, was because we've left that layer of unmet need. Other questions on how you would separate that or how we got to the current reserve in the first place? And Devin, what should we expect between now and our budget meeting then in October?
So I think if there, you want to give this more thought or think about it, then, I think please let me know if there's any other concerns or questions. I would say by the end of this month or early September, we would be formulating the budget at that time, and we'll be sending that out in advance for the pre-reads. And the intent, if we move forward with a specific approach, would be to kind of have that reflected in that budget, along with all the other normal annual budget reviews, and then sort of have the budget in whole voted on for the October meeting.
Other questions on kind of process, how we got here, what Devin's planning for October in terms of how we structure this piece? Not seeing any questions. I think, Devin, you can move to the next agenda item.
Okay, great. All right, so we are back on a topic that we've covered a couple of times through board meetings this year, related to simplifying plan choice for consumers. Here, really discussing featured plan display, and the just recapping the last meeting where we really discussed a proposal where there would be 3 plans per metal level per product type, plus potentially 2 additional plans. So that'd be potentially 29 plans per legal entity that an insurer would offer through Pennie. There were a lot of concerns raised with that proposal across the board related to potential gaming of that legal entity level, concerns around consumer disruption of what would happen if consumer was in a plan and that wasn't one of the 29 plans the following year, and sort of concerns around that crosswalking of if they were crosswalked into something that ended up being a surprise for them. And there were also concerns around defining the 2 additional plan criteria, I think from across the board as well. But there still seemed to be a real desire to try to find a way for consumers who are looking for a more simplified experience where there aren't significant number of plans, there still seemed to be a desire to try to work towards a solution that would provide that experience. So we have, kind of went back and retooled and have a different variation of that where it's in essence almost implementing that proposal or something similar to that proposal, but in a way that consumers can opt out of that and see a broader set of plans. So David's going to walk through the specifics, and then we'll be looking to see where we are with this one. So David, I'll turn it over to you.
Thank you, Devin. And yes, we are back, but with a different approach to hopefully achieving the same goal. So appreciate that introduction. What we wanted to talk about today is really how we are pivoting our approach to simplifying the customer plan shopping experience. As Devin mentioned, we've received a lot of feedback throughout the year, at the staff level, at the board level. And when we kind of took that back, we wanted to adjust our approach, but still aim to achieve the original goal of this policy, which is to simplify and improve the plan shopping experience for our customers. And by making the number of plans that they could review or must review to find the best plan a little bit more manageable, especially for those counties where there's upwards of 70 to 80 or more plans. So this approach would, rather than allowing a certain number of plans on the platform, Pennie would leverage our plan filtering options essentially to display a limited number of plans initially to customers, while giving them the option to see the full display of plans. So essentially, we'd be adding a new kind of filtering feature, a default filtering feature that we're right now referring to as featured plan display. But that's, we can workshop that. So this plan would really put customers in the driver's seat to determine kind of the experience that they want, especially in those counties where we know that there is a lot of dozens and dozens of plans to sort from. So this approach will allow customers to tell us how they want to shop, rather than us dictate how we want them to shop. And then on the opposite side of the coin, rather than tell the insurers, how many plans by each metal level and product type they are allowed to put on our platform, they would tell us what essentially they believe are their best plans or their featured plans. when we looked even further into kind of customer preferences, and we've done a lot of customer surveys about obviously the plan shopping experience, but something kind of illuminating, and I think at least the light bulb has gone off in my brain and our brains, is that I think every customer is different, and everyone has, and really when people say, some people say, well, I want fewer plans. Some people say I want more plans, or some people say we have the right amount of plans. It's really about trying to find that number that allows them to find their plan, and their plan is different, and everyone has different needs. So what this does is, again, it acknowledges the uniqueness of every customer that we have, and gives them the tools that they need to hopefully improve the plan shopping experience for them. So again, next slide, please. Thanks. So again, what we're trying to do here is reduce the number of plans that a customer initially sees, and helping those customers who currently feel overwhelmed by plan shopping, see a more manageable view. Those customers who don't feel overwhelmed, that want to see every plan, can still do so. One of the things that we heard a lot of feedback on was concern about, what would happen to customers who were enrolled in plans that that were no longer allowed to be offered on the platform. Well, we have eliminated that. This would ensure continuity for current enrollees. All plans would not show up initially, but no plans would be excluded from the all plans view. So this will avoid customer disruption, which again, we heard a lot of feedback on, that eliminating plans would create a worse experience for our customers whose current plans were eliminated. And not only, I think, will the plans not be eliminated, but we hope that this will allow them to be better active shoppers, and allow them to better compare their current plan with other plans available to them during the open enrollment period. So what is this going to look like? So insurers would determine which plans they want to feature in the featured plan display. Insurers could feature up to 6 plans per meta level, with no more than a total of 15 plans featured. So when we talk about our previous proposals allowed for, if maximized, a total of 27 total plans per legal entity. This reduces that number to 15 featured plans by parent company. So regardless of how many legal entities an insurer may have in a given county, the number of plans that they can feature is the same. And then the insurers would need to include the lowest cost premium plan for each meta level. What this will do is further incentivize, I think, people. We want to continue to feature those plans that are affordable. Obviously, we know that premiums are a huge driving force in terms of what people want to purchase or initially look at. And this would, including these plans, would again, help provide customers with a full display of being able to see plans from all insurers, and not just a few. So, and again, really, we feel like it's really important that we emphasize the fact that this is at the parent company level. We had heard the concerns about making it by a legal entity. So this will create an even playing field for all insurers to have the same number of featured plans in a county, and will also hopefully allow customers to be able to see each insurer, in the first couple of pages, rather than have to sometimes, go to page 4 or 5 to see different insurers. And and then another benefit for us is that we get to learn, right? We think we know, we have an idea. We've asked customers what they want. We have the research on what the research shows in terms of what overwhelming plan choice or overwhelming choice can do to customers in all walks of life. But again, we have a unique market, and we serve, right now 435,000 unique Pennsylvanians. And so we'll be able to learn from this, and essentially allowing customers to vote with their feet on what they want, and will allow us to better inform future innovations, proposals, things that we want to do with the plan shopping experience. Next slide. So this is just kind of a quick mock-up of what this may look like, and really it's just to essentially show where that toggle button would be. So, if we called this the featured plan display, that would this would be the default view, and it would be toggled on. Customers would then have the easy option to toggle it off, so that they could see kind of the all plan view. Some things that I think we need to continue to discuss. And I want to emphasize, this is for plan year 2026. We're still in kind of that plan certification process. So we do have, I think, some time to work out kind of more of the operational details. But, what is the best way to just, to communicate the featured plan display option for customers, and how they can go to the all plans display if they so choose. And then, is there a way for, let's say they're, an insurer has a plan that they didn't initially want to feature, but mid-year it looks like it's performing really well, or they want to swap plans mid-year, exploring kind of a potential opportunity to do that. So I think what we're looking for today is really approval to move forward with a plan display option. But knowing that this conversation is ongoing, and we want to continue to work with stakeholders, in order to ensure that we are informing our customers the best way that we can. So so that we have the outcome, which is a better plan shopping experience that we want. Before I close out my spiel, I want to thank everyone for the great education that I've received on the uniqueness of every market, of every customer, of every insurer, of every broker and assister. I have learned a lot in this process. I think we have arrived at an approach that is truly a compromise, and but will allow us to achieve our goal the entire time, which again is to improve the plan shopping experience for our customers.
Very good. Thanks, David. Guess we will open it up for questions for those of you on the board that have been around for a year, maybe less. This is a conversation we've been having for 2+ years, I think. It started as a conversation, and we were looking at different opportunities to reduce the number of plans that are available through the shopping experiences. I think we heard that there was a degree of analysis paralysis, where there were so many options that people were not interested in. It made a shopping experience less appealing. We initially started with plans to remove plans that didn't meet certain enrollment thresholds, but we moved away from that we moved away from that proposal. Then we moved towards one that would have more strict limits on plans. We moved away from that as an effort that would potentially limit innovative plan designs, limit market availability. And I think what Devin and her team have done is come up with what really seeks to be a compromise. For for those people coming to use the platform, it will limit the number of options they see. However, as you can see on the screen that we're looking at right now, very prominently, you can make the election to see all plans. So while it will default just to the insurer's preferred plans, which I think the idea is to have that always include at least the lowest cost plan from the insurer in that space, the consumer will always have the opportunity to expand that plan display to see everything that would be available to him or her as they're going through the Pennie process. And just for, I guess, contextual help, PID has approximately 400 plans currently pending before my rate informed filing team for 2025. And that's not to say everyone in every county will have 400 plan options, but it is to suggest that is a significant number of plan options. So I think there was a lot of negotiation with a lot of stakeholders that had to take place to get us where we are today, and would be interested in kind of the thought process of the group on how we kind of advance this conversation or potentially motion forward to allow Pennie to develop the feature plan display starting in 2026, along the lines of what David had suggested. So opening it up for comment, feedback, thoughts, and questions. Any questions? Alexis?
Yeah,
Alexis, then
not so
Colleen.
much as a question, as a comment. I think, David, I appreciate what you had to say about your willingness and openness to everything that you had to hear. I would say likewise, I think we appreciate all the work that you all did to listen to all the feedback and try to come up with something that accommodated it all. So just wanted to put that out there because I know there's been a number of somewhat contentious conversations about it, and you guys did a really nice job.
Thank you, Alexis. Colleen?
So I would just echo Alexis' comments. I appreciate the collaboration and compromise on this. I think ultimately where we landed, I think from creating a stable marketplace, I think that this was an important, step to take. I think some of the other plans that we talked about could have created a lot of disruption year over year in the market. I think this ultimately will allow, to the points you made earlier, David, for people who want to just look at a more simplified view to be able to do that. But for others who do like to look at and want to have plan choice, the opportunity to do that. So from my perspective, I think this is a win for consumers, and I appreciate everyone being willing to, take things back, look at things a little bit differently, and come up with a solution that hopefully works for all consumers. So thank you.
Tia?
Well, thank you, Commissioner, for the synopsis that you gave a little bit earlier. And thank you to the rest of the team. I really appreciate the time that you have put in to try to bring a consensus to a very, I'll say, turbulent conversation. And this discussion, again, was birthed on the basis that customer feedback was there was too many plans, where it got to the point where folks just didn't enroll, or they enrolled in the wrong plan, or it was too expensive coverage for them to use because they enrolled in the wrong plan. And I know there have been discussions with other states about what they've done and what they could do. I don't want us to lose sight, again, since this has been a very long process, that our consumers are first and foremost the reason why we're here. And they have expressed year after year there are too many plans. With the screenshot that I see here, with the toggle, is there an opportunity to have additional wording next to the toggle so that they understand what a feature plan display is?
Yeah, so I mean, this is, yeah, so I think one of, again, the items for additional conversation is about how do we ensure that our customers are fully aware and informed on what this display is and how they can get to the all plans display. So that is very much a conversation that we are looking forward to having with stakeholders. And to make sure that our customers are informed. So yes, there is certainly an opportunity for more text. This is just kind of where we were thinking about that, where the toggle would be. But yes, we definitely do want to have more information for customers.
Okay, and because we've been in discussions, and this is open, that there has been appetite for compromise, some additional things that I would like to see or need to see in order to be confident is additional data if this proposal goes forward as proposed and as written, and a willingness to return to the original proposal that plans be reduced going forward should we approve the proposal as written. I'd like to see a little bit more teeth with this to ensure that consumers, the ones who we're looking at every single day who are enrolling, have the opportunity not just to have a toggle button, but what they've originally asked for, which was fewer plans to choose from.
I would say, and one of the points that David made, I think part of the discussion that we've had and has been one of the toughest pieces is about the data that we don't have, which is how many people, when they have a simplified option, stay in that and are happy with that, versus the ones who are not finding what they need there and look for a broader set of plans. So I think the intent is fully to be able to look at consumer behavior with this and see how many people are staying and see what their satisfaction is, and see, like, do some answer some questions to see, have consumers answer questions to see if they understood what they were doing and that if this was helpful to them, and use that to inform our approach long term. I think it's also, I guess one more point to make that we've made other times when we've talked about this is that this wouldn't be the end of the conversation around how to help people choose plans. I think there's a lot of different things that have come up in these conversations around making sure people really understand the trade-off between premiums and cost sharing, and how do we, people who are eligible for cost sharing reductions, what more can we do in that? I think there's a lot of pieces that we can continue to talk about and add in to the consumer decision-making process when they're looking at plans to support them in that way, that are, like, some might be around what are we seeing from the data, and if everyone's staying in the future in the future plan display, what is that telling us, and what should that tell us moving forward? And also all these other conversations around making about health literacy and helping consumers really feel confident in what they're buying and that it meets their needs.
Tia, does that answer your question? Gives you something to
Yes,
think about.
something additional to think about.
Yeah, thanks. Antoinette?
Thanks. And I echo everyone's sentiments. I appreciate all of the work that has gone into this. From the consumer perspective, I think it's a step. But to go back to the commissioner's first statement, I mean, there's 400 plans you said that are filing, which is, 400 plans, which is too many. So, while this could have minimal impact, I echo Tia's sentiment that I think we want some assurance that we're going to go back to the original conversation about how do we actually look at this in a serious way and put some teeth on this. I think I'm very concerned about how individuals will approach this. So really looking at the data to see how people are picking, and insurers are allowed to swap a plan mid-year, understanding why that's happening, the impact to consumers, I think will be really important. I also would request that we do some beta testing to understand with real folks how they would approach this. Do they understand that the hover over text here feature is here to see more plans? Do they think they need to pick the first plan on the screen? I think we just don't understand the impact of consumer behavior on this. And we don't have the answers about, do folks get locked into a plan because they don't understand the other options, or just shop based on what they see on the screen with plans that issuers are putting forward that may or may not be in the best interest of consumers. Whereas if we, put some teeth in limitation, it could switch some of that dynamic. So I'm not convinced that this is the answer. And I think that I would want some assurances that we actually are going to revisit this in a year, because I don't see it as exactly the most consumer friendly answer to the problem.
Amy?
Thanks. Yeah, I agree that this has been a long process. I mean, I didn't even join this right away. I know it's been going on for a couple of years. I've only been here for about a year. So I would also like to see a little more teeth. I'm not entirely convinced that this will help consumers. I think it really is going to depend on what market they're in. So in Philadelphia, I think it will have almost no impact at all. It might in other counties I was looking at. I was just sort of like looking at it if it were in effect today. So I'm not sure, in Philadelphia is probably the biggest market. So to have so little impact, I don't know if we're doing that much. I just had some other things about like things to look at if this is what we're gonna do. One thing is I noticed that that the lowest premium plan needs to be put forward, but that's not necessarily the most affordable plan in each metal level. I wondered if you thought about the also requiring the plan with the highest actuarial value within a level. Now, for some plans, all their silver plans might be 70, but some might have some that are higher. And then in terms of what information to collect, I don't think it's enough to just look at whether people are toggling in and out of the featured plan display and whether they choose a featured plan in the end when they've done that. I think you want to look at what happens with how do people stay in these plans. If or I don't know if you can do this, but if people who choose a plan using the featured plan display, what do they do next year? Are they switching out of that plan, or are there complaints about the plan? And then also looking at some data on the substance of the plans that wind up in the featured plan display versus the non-featured plan display. So, I mean, for some insurers, all of their plans will be featured in a market because maybe they only have 3 in a market. But in others, they are going to have some that are hidden unless you've untoggled the button. What is the difference between those plans substantively? Is there, are they, what do you find about provider networks? Are there like, lighter provider networks in the featured plan display versus more robust provider networks in the ones that you have to kind of search for and dig for? So I think there's a lot more to really gather to know if this is actually going to be effective. A lot more data.
Thanks, Amy. Other thoughts, questions, or feedback?
And I did just want to respond. I mean, I think definitely filling out what metrics we want to see and doing, we've also been collecting some really interesting consumer information that we're excited to share with you all at the next meeting as well. But I think it provides a helpful baseline as far as some of like how people are experiencing their enrollment this time. So I think that's a great point. And on the consumer testing, I think, we should be able to have enough time to do a little bit of that so we can explore what options we have on that front to make sure again that it's clear and that consumers are sort of understanding their options when they land on this page.
So, Devin, the thought today really is, I mean, we'd be making the definitive step of moving in this direction, but there would be additional conversation, like on lowest premium versus potentially actuarial value of a plan, or what that toggle button actually says, or kind of the pop-up information that the toggle button gives you, right? Am I thinking about that right? That like really this is this is the green light for you within these parameters to have continued stakeholder conversation, potentially to include focus group testing over the next year before we get this ready for 2026.
Yeah, that's exactly right. Because of the various curves and bends that we've taken on this policy, we wanted to make sure we sort of had, as you said, the green light to kind of commit more time and energy to really fleshing out this and really kind of putting within these parameters, putting that meat on the bones of exactly how it would work and the different flexibilities, how it'd be communicated, all those pieces. So that's really the intent, to make sure that we're kind of all on the same page moving forward with those more detailed conversations.
Okay, thanks. Other questions? Alexis.
Yeah, I do agree that we should measure how this impacts consumer behavior. I'm a little concerned about saying we're gonna revisit in a year. I guess if this gets implemented for, next OEP, then we're looking at, I don't know. I just feel like you need some data points, and maybe we need to get clearer about which of those data points we're trying to impact. As I heard, some people just get fed up and don't want to join at all. The notion that people are picking plans that they shouldn't, I'm a little curious about. Like, what is it that what are we seeing that they're picking plans that are not right for them? Now, I know there is some discussion around, I know there's concern for why people pick bronze and so forth, but just overall, if we are seeing other indications that people are picking the wrong plans for them, I think we should sort of share that with the board and know what we're looking for when we see it, right? If we're saying we're going to measure changes in consumer behavior. So I think that's just as part of the process we still need to go through. Like you said, I'm reacting perhaps to the notion that we'll be able to figure that out in a year.
Sure. Colleen?
Yeah, I guess just to piggyback off of Alexa's comments, like, can we remind me of the timing again? If we're revisiting this in a year, we actually won't have data, right? Like, this is being implemented for which open enrollment?
Yeah, we wouldn't even talk about this till 2027.
Okay,
I mean, we're talking about implementing it for the calendar year 2026. So I guess maybe late 2026, after we get through open enrollment, we could start having it at like the August, October timeframe board meetings. But I mean, I think we're 2 years away from kind of having data to really talk about outside of the consumer testing that would take place potentially between right now when we greenlight the concept and any feedback that Devin learns from people that maybe they don't like the toggle or other just kind of operational pieces. But I wouldn't envision coming back to have the conversation about data until at the earliest, I think, Devin, mid to later 2026, right?
Yeah, having that open enrollment close, and then, I think doing the analysis will take a little bit. So I'm thinking mid-26 sounds about right.
But I mean, it couldn't be earlier than 2026 because we wouldn't have data until open enrollment ends in January of 2026. So, I mean, to Devin's point, they need time to go through that data. They need time to see what happens with those that have made their selections. Obviously, there's some other issues that come into play between this year and 2026. So, I mean, I think that's when we would have the conversation, and I don't think it's different than really any other program that Pennie initiates and implements. Like, we went back and reviewed Path to Pennie and continue to do it after we brought that forward during tax season. We'll look at kind of how the other programs that we've had, the retro enrollment piece has had an effect. I think we would come back to review this program once we have data for the program. But I don't know that we can, I don't think we can agree to metrics before we see the data. Like in my mind, we greenlight operationalizing this for 2026. The Pennie team continues to work with us, continues to work with stakeholders to get this program in place for 2026, and then we come back and look at that data on how it impacted enrollments.
Thank you.
Other thoughts or questions? I thought I heard somebody try to chime in.
Just want to ensure that with the upcoming motion, are you ready to make a motion, Commissioner? Or?
I'll read it, and it's intentionally like it gives us the flexibility to continue to have kind of the operational build of this program. So the proposed motion would be to allow Pennie to develop and adopt oh good, thank God. So it's on your screen so everyone can actually read it. But for those that are on the phone and don't have access to the screen, it says to allow Pennie to develop and adopt a featured plan display starting in plan year 2026, where insurer parent companies will select no more than 15 of their plans in a given area in a plan year to be displayed through Pennie in a default display page. Through this feature plan display, customers can view all parent companies' featured plans as default, but also have the option to view all plans if they make that selection. So it doesn't say exactly what the screen would look like today, because it essentially gives them the green light to continue those conversations on the development of that screen and the follow-up afterwards. I don't know that we need in the motion language to come back and review the data, because I think that's ordinary course for us as the board. We implement a program and we need to oversee it. So I think absolutely once we get the data starting to come back onto how this changes behavior, if at all, and kind of the Pennie customer satisfaction, that we would come back and have conversations about that at the board. I don't know that needs to be included specifically though, because that's what we did. Other questions or concerns with the language in the actual draft, Antoinette?
I don't see anything that mentions including the lowest cost plan. Is that intentional for leaving that out, or why is that not included in there?
David or Devin, did you have thoughts on that piece? We could put it in, but I just also heard Amy say that it may not be lowest cost plan. So maybe that warrants some of that further discussion on whether we want lowest cost plan versus a plan with a more significant actuarial value. I think that the challenge there being lowest cost plan potentially is the one with the most cost share in some areas. So maybe to Amy's point, that isn't the most cost effective plan. But I don't really feel strongly one way or the other on whether we put that in. Amy?
Well, as a person who mentioned that, I do think that needs to be something that says, like, I mean, if we're going to discuss what that means, we could say that it has to include the lowest cost plan, the meaning of which we will hammer out, whether that's the lowest cost premium or the lowest actuarial value, which of course can change if someone's getting cost sharing reductions. I'm not sure how that works. Because I'm assuming the featured plans are the featured plans for everybody and don't really take account of whether people have CSRs.
I would just say it wasn't necessarily intentionally excluded. I think it was more to kind of encompass the overview of what's in the slides that, we'll kind of have permanently here, to say that without putting all of it in there, just that's the policy we've talked through today. those policy parameters would be what we would be looking to move forward with. So we can add it or not, but that it wasn't necessarily more than anything of just trying to have this be more of a summary point for the motion.
So you could add something at the end of the first sentence after page, like comma, including the lowest cost plan as defined by the board or something like that to give us flexibility. I mean, I think the conversation is clear here that we want a cost-effective plan to be one of those 15 plans. But I don't know that we know exactly how we want to define it yet. So if there's other suggestions on how to do it, I'm glad to entertain those. Tia?
Well, if that's, I don't have a suggestion on what Amy was just talking about, but I do want to see something about revisiting this at a future date. Because I just feel like it will get lost and it will get overlooked in the compromise of things.
And just to add on that, adding the importance of analyzing the data is important, right? I mean, I think to make me more comfortable about this, I want it revisited. We need to analyze the data. And I really want to make sure that there is consumer data, like real testing on this to make sure we're getting it right.
Okay. Editing on the fly. Let's see here.
Well, there's editing on the fly going on. I mean, I will say too that we had this official record of this meeting where we've, I think, committed to doing a look back in mid 2026 after the data has been compiled and we've had an open enrollment underway, to be able to analyze that data and define the metrics ahead of time and to have the intent of a lowest cost plan and then define that over the next coming couple of months to provide clarity there, for moving forward. So we can put it in the motion. We also have, this official, the recording and the slides will all be a part of the official record as well. So we're on the record of saying it too. So either way we want to go about it.
I think it would just make me more comfortable. I mean, maybe we'll all still be here in 2026. We don't know. Like if it's on the official record, right, someone has to be responsible for that. Whereas the other way, someone has to go back and kind of dig up the records or remember in 2026 that this conversation occurred.
Just from my perspective, I mean, since, I think every time I think I've proposed nearly every new policy that we put in place, and I'm pretty confident that when the board has directed us to come back and say, hey, how do we do? We've done that. So we certainly, our goal is to improve the customer experience, while maintaining kind of consensus on the best way to do that, or the most viable way to do that. So yes, it's in our business interest to go back to this policy and all of our new policies to make sure that it's having the intended effect. And if it's not, we certainly want to understand why not and what more we can do. I don't know. I don't want to speak for you, Devin, but I'm going to. I think we can commit to certainly year over year going back and seeing, what impact does the data show that this had, and what more can we do in the future, again in the spirit of working with you all to make this work the best way we can.
I have some drafting, but Cheryl, why don't you go ahead?
I just wanted to say that, and I think this probably goes without saying, but I think everybody on the board, the insurers included, all want the same thing. I mean, we want to continue to evaluate this and do what's best for the consumers. I think everybody has the consumer's best interest in mind. I just don't want that to get lost from an insurer perspective.
Yeah. Okay. So trying to, I'll go ahead and post it in this chat and then also read it so people have an opportunity. It tries to incorporate, I think, the three themes that we've had. I don't know if it's actually going to post in bold text, but I've bolded it in the event that it does. But so here it would say to allow Pennie to develop and adopt. That's the same. And I would add in commas, following consumer testing, comma, a featured plan display starting in plan year 2026, period, and I'm not going to read the next part, to be displayed through Pennie and a default display page, including the lowest cost plan as defined by Pennie, is how we would end that first sentence. After the second sentence, I would add a new final sentence saying the board shall review customer experience data beginning when data is available during plan year 2026. Because I think it's going to have to be after open enrollment, but I still think it might be somewhere during that calendar year. So I don't really want to bind us to a specific date on when good data is available, kind of defer to the Pennie team on when the data comes in, when it's clean. But I tried to incorporate consumer testing, the lowest cost as we'll continue to define over the next several months, and then the return to start looking at data. So we guarantee to have that conversation as applicable here. What do people think about those additions?
Thank you. I'm a little bit more comfortable.
Amy,
I
go
agree.
ahead.
Hey, I'm just wondering, I don't want to, I mean, I like where this is going. I guess the one thing beyond that I'd mentioned beyond the customer experience is really understanding what is featured and what's held back to see. Because that's where I get concerned about, what plans are really being put forward and what are not as readily available and what features substantively, not really necessarily in terms of cost that those plans have. Do they have,
So-
I think I gave the example of, do they tend to have more robust networks if they're held back, and is that something that people are missing out on? So just sort of
So
an
maybe-
analysis of the plans.
I wonder,
Yes.
Amy, yeah, if it would be like the board shall review customer experience data and feature plan activity beginning when the data is available. So to encompass kind of really anything that we'd want to look at in that space of how the featured plan may have changed, how it was determined, but leave it broad enough to kind of figure out what it is that we want to look at then, but know that we do want to look at how that pivoted throughout the year, if at all, and how it may have played itself out from a market perspective.
Well, not just featured, but like what's featured versus unfeatured plans.
Okay. Yeah.
Just to
ready,
understand
player?
it.
Colleen?
Sorry, I'm just getting a little bit concerned with some of those comments, truthfully, because if we were going to limit plans and carriers only had a choice of X numbers, you weren't going to dictate what plans a carrier would be able to choose would push forward, right? But now we're having a conversation around dictating what gets featured and not gets featured. And I'm concerned that some of the assumptions are being made that we're pushing forward some personal agenda versus what is best for the consumer, right? Some of the concerns I shared when we talked about this topic before with limiting plans was just exactly what you're saying, Amy, that we would have to choose between showing plans that had full networks and limited networks, right? And that was a concern why I thought we needed to have more than the plan options that were being dictated. So I am getting concerned about what kind of parameters we're potentially putting around carriers and what they can choose to feature or not feature. So that is concerning, right?
I wasn't, yeah, I just to clarify, I wasn't suggesting that it's, I was saying we to understand what's being featured and not featured, not necessarily saying that Penny, because that would evaluate whether this is something that, how it's working out for people. So, I mean, if I'm not saying that this is what you're gonna do, but like if it turns out that the lighter network plans are being featured more often, then maybe this doesn't make sense overall, and we go back to what we had in the beginning, right? What we have today. So I'm just trying to I think it's important to understand like what impact this has on what consumer choice. So I
think
wasn't
it's really
necessarily
about
saying, sorry.
No, go ahead. I was just gonna say, I think it helps bring transparency to the process and understand the choices that consumers have, right? If every plan featured is a limited network plan and folks get stuck, just looking at the data to help understand that, right? It's not putting any
Right, but I guess
regulation on anything, it's just analyzing the data.
And I guess I'm just curious, like, what are we specifically saying we're going to change here? I mean, and I think when we say beginning when data is available, that could be that you have, the way that's written is like you could have a month's worth of data, right? I think we need to have some sort of qualifier there as to when we think there's actually sufficient data to start making any kind of assumptions. Probably aren't the right word, but that's what's going to be happening. People are going to be making assumptions about the data at a certain period of time. And I think we need to make sure that there is sufficient time for the data to mature before we start to be making, statements about what the data is telling us. And I guess I'm just worried about defining what we're looking at right now as far as the data is concerned. I think keeping it more broad about data.
Yeah,
I would assume we'd be looking at
hopeful
all
the
of those
executive
avenues, right?
director and chair wouldn't just decide data was available after a month. But I think if we just say beginning with sufficient data, maybe that's good, because I don't think an irrational understanding of reviewing kind of how open enrollment worked and the data available. I think we all know that data needs to mature. So, I mean, if we come in January 16th, we don't have the whole story yet. And I really think, I mean, August or the summer at least is probably when you would do it. But I mean, I think sufficient data probably gives enough cover, Colleen, to
I'd be fine with
make
that.
it clear to the board chair. And if the board chair and executive director felt like it and came back to review this recording, I think it's pretty clearly on record now that we don't think you have the appropriate data to make a decision on when it's time to come back and start looking at the data in January. Future board chair, future executive director. So we have it on the record. Now I think just to hit Amy's point, but also Colleen to hit your point that last sentence isn't intended to be limiting at all. The way I drafted it, I just meant that we come back, we look at consumer experience, and when I was trying to add plan designs, I think the board should understand what was offered, what companies selected as the default and what went into the other. So not making a judgment at all, but just as we review, when we come back in a couple years, I think we should factor into our review what plans were selected by companies as the default plans and what weren't. But that's all I meant to say, is just consider that as part of the re-review of the program.
And I guess from my perspective, I would rather phrase that as consumer buying behavior or something along those lines, as opposed to specifically targeting what plans were available, because how that was being positioned was more around like, hey, if we're really only featuring plans that have what some people are perceiving as bad choices for the consumer, because it's exposing them to maybe not having availability to network or more out-of-pocket exposure. I don't think, again, that's for us to choose. I think if we want to look at consumer buying behaviors and decide whether the buying behavior activity is not what was intended, then we can, I think that makes sense. But I think to say specifically, do we think that the plans carriers put forward get an A or get an F as far as what was put out there, that doesn't make sense to me.
Yeah, and I think an interesting question, for example, if this is getting a little bit to your point, is saying for the people who toggled out of the feature plan display, is there any theme to what they bought in the all plans? Like, did we really see a gravitation towards this type of plan in the whole set that tells us all something about what people are looking for and maybe what they didn't find in the featured plan display that they kind of went searching for in a broader display? I think that could be really interesting. I mean, I think what, I think it'll be really helpful to kind of see where people stay in that, where people come out of that, and just kind of learn from that behavior to help inform and get more information about what consumers are really looking for. So I guess I kind of see the value in it from that way, just to, evolve our understanding of those preferences and what people are, and decisions that people are making.
Yeah, so my latest edit would have just added and available plan design. So not even featured versus not featured. It would just say the board shall review customer experience data and available plan designs beginning when sufficient data is available during plan year 2026.
I would say I would prefer that it said review customer experience data and buying behaviors. Just because I think it comes more down to what Devin was just saying, like, what are they actually ultimately doing? Are they sticking with the featured plans? Are they purchasing other things? Do we see trends in what people are buying that are different? And if there are concerns with those buying behaviors and trends that we're seeing, then we can talk about what modifications need to be made. But I don't know what data that we're going to get is going to say whether the available plans were the plans that were needed or not. A consumer would like to say, I'd like a plan that has extremely low cost sharing with a low premium. We'd love to be able to give them to that, but that's, unfortunately not how everything works, right?
Yeah, I think the tricky part, and I mean, maybe you just change it all together to the board shall review the implementation of this program when available data is available during 2026, because I think the more we nuance the sentence, like we're clearly going to look at how it is implemented overall into different pieces of it, and maybe just providing too much specifics me just kind of is not necessary, because we do want to look at the program as a whole and how it impacted Pennie, buying behaviors on Pennie. I mean, what was available to consumers. And I mean, we could just leave it at that and not go into the specificity, because that leaves even more direction, or more discretion, not direction, to the board when this comes up again, and to what we would want to focus on at that time based on what data tells us.
I think that,
because it doesn't preclude us from looking at any of that anyway. It's just
right.
listing it.
Yeah, I would agree with that.
I prefer the way it's written right now. I'm not sure why we wouldn't want to be clear from the get-go that we want transparency on what's being put forward, and and on the customer experience, and what's just sort of how this is implemented overall.
But the Pennie board does not dictate what plans a carrier actually puts on the market. The
Yeah, I
Pennie board,
recognize that.
that's when you look at that statement and available plan designs, that is saying that Pennie has some authority over the plan designs that are actually offered.
No, I'm not
But
saying
why
that at
can't
all.
Pennie look at?
I know, but that's how it could be interpreted, right? I know that's not the intention, but from my perspective, I think that that's how it could be interpreted.
So it's really plan designs on the all plans versus featured toggle. Would that be preferable?
We could say customer experience data and plan design preferences. Would that be, would that help?
I'd be more open to that.
That's
But I
still
think- 'cause
leading
I think
on.
this-
I guess we're just trying to understand like what plan, I mean, what I was looking at is like what plans are featured and what are not featured. And why is that something that's concerning to see? What's the
'cause I think it's more,
resistance?
if we're trying to learn
Well-
from what consumer behavior is, then it's what is the consumer choosing and what their paths are they taking, right?
Well, I mean, to be honest though, but the plans are now being given an opportunity to feature certain plans. So that is like I think that's actually significant for the plans to be able to do that, to make decisions about what they want to put forward over what they want to hold. I mean, some plans are not going to have any choices, right? Some parent companies, because they have 7 plans, but others will be able to, sort of not feature some plans. And I don't understand why we wouldn't want to understand what gets featured and what doesn't.
But going back to the purpose of this, it's again, putting consumers front and center. It's what they decide that matters, not what insurers plan to put out on their display page. I mean, consumer choice matters. That's what we're gonna look at. What do consumers think? I think rooting it in that is what we all want.
And I think
I
too
guess-
that
Yeah, we're gonna have
I
to
was,
go
I was just
back
gonna
to-
add, like, like
Go
the
ahead.
plans will be public, right? I mean, so everyone will be able to see what's featured versus what's not. And I think so it's not, I mean, it's not like there's gonna be data hidden anywhere, right? I mean, I think we try to, whenever people ask for data, we provide what we have. And so I think, the commitment is there to look at the program and look at the implementation, and board members at any time can say, can you please tell us more about this? I mean, that's not going to change, 2 years from now. So I guess, if there's a way that people feel comfortable to kind of make it broader now, but to kind of be encompassing, like evaluate the implementation of the program. And there's the public data, there's the ability for anyone to ask anytime for more data on something. So the intent is not to not look at something. It's just to perhaps, leave the granular decisions about what we're looking at versus what we're not, to kind of, when we get closer and sort of have some more of these pieces figured out, to kind of really develop that metrics plan.
Yeah, I mean, sorry, it's Alexis and raise my hand. I think there's a work to be done over the next, couple of years to figure out. Maybe if we work together to put a plan in place on what we think we should measure and why that will be an important indication of the success of this program. I feel like the devil's going to be in those details. I don't think anybody, Amy, I don't think we are trying to keep from hey, like to Devin's point, did people go chasing a certain type of plan off feature display? And what does that tell us all about consumer preferences? It might tell us that, holy smokes, they went an extra couple of steps in order to get to something. But, I think this board's going to need to get past the feeling that insurers are putting plans up that are somehow nefariously intended to mislead a consumer. And I think that's what we're reacting to right now. I don't know that is what is meant to be said, which is why I feel like we should just kind of put a general statement in place on this and then agree that we are going to work over the next, 18 months to figure out, hey, what is important to measure in that consumer preference so that we all do a better job for the consumer. So that would be my thought.
And yeah, and I guess my reaction to that is, and I think we want to look at the data, we want to look at everything, the plan designs, all and featured will be available. So I'm okay with putting that off. I just, this is about like, I'm coming from the consumer. I'm on this board as a consumer advocate. That's the slot I'm in. And so from my perspective, it's not just about consumer choice and choice overload, which is what we were originally trying to address. It's whether this is really going to help consumers. not just their preferences, not just how they make choices, but are they, so if, we want, that's why it's so important to know what's out there. So if we find that everyone starts using the featured plan display because they don't really understand that they can go elsewhere and they aren't picking the all plans, what does that mean? And is there something in the all plans that might have helped them? So, I mean, it's just
Yeah, I
really
mean, it
about
is possible that
transparency.
the more you limit choice on initial displays, the more consumers might not make different choices. I mean, that is the slippery slope of
Right.
the more you limit it, the more you might have made a mistake in, not featuring something that a certain consumer would want. And I think that's been the kind of the cause of some of the, the concerns going back and forth for the last couple years. But I mean, I agree with you. We should look at that. Like, what if we have made a change here that doesn't help them? We're gonna have to reserve, like, I think the word judgment was used, like
Right.
that judgment's probably not the right use, but I feel like we are all kind of getting at the same thing. I don't know if there is a way that we can commit to a work group to put together. I think the other thing is, like, we're sort of talking about these consumer preference measurement as a boogeyman. Like, let's kind of look at what we would want to measure and, and why and what it would work through details. Then we'll know exactly what we're going to look at in, 26 or 2026.
Well, and I think maybe the consumer testing that Devin's going to do may help tell the story
Yep.
of what we want to look at further. So what if we just said, I mean, keep in the customer experience data and just say, and market activity, which can be broad. It can be, instead of 400 plans, maybe I'm getting 250, and we want to think about that. Or maybe companies are expanding, contracting. Maybe there's a new company that comes in. I think it's just broad enough to suggest that we're looking at all things related to implementation of the plan. Because I think on one hand, I'm hearing we all know that we're going to look at implementation of the plan, but just plan implementation is not specific enough for some. And in the interest of getting to a place where we want to have compromise, as most of our decisions have been consensus decisions, I think we give a nod to kind of what's generally in the market in addition to the customer data. So, I mean, it's your buying patterns and kind of what's in the market, but not so far as to suggest to the companies that we're dictating what plans need to be there and what plans need to not be there outside of the lowest cost plan that we'll define in the future. Does that strike enough of a balance that, and I will paste it here with the most recent language again, this time in parentheses in that last sentence, because I think we're good on following consumer testing. I think we're good on including the lowest cost plan as defined by Pennie, and that's what a working group will continue to work with Devin on in some way, or Devin will engage stakeholders on. I don't know if we need a full working group on that, but I think if Devin continues with David to reach out to people, we can get to consensus there. And then the board reviewing the customer activity and customer data and market activity. I keep forgetting sufficient, when sufficient data is available during plan year 2026. Colleen?
That was my only add, just the sufficient. So you got it. Thank you.
I keep forgetting sufficient. Let me write it. I'm going to repost it again just so I make sure that I have sufficient, because I keep dropping it. If I can spell sufficient. Okay. So now I think we have everything we want there. So I would be looking for a motion that would be to allow Pennie to develop and adopt, following consumer testing, a featured plan display starting in plan year 2026, where insurer parent companies will select no more than 15 of their plans in a given area in a plan year, to be displayed through Pennie in a default display page, including the lowest cost plan as defined by Pennie. Through this feature plan display, customers can view all parent companies' featured plans as default, but will also have the option to view all plans if they make that selection. The board shall review customer experience data and market activity beginning when sufficient data is available during plan year 2027. Do I have a motion?
I just have a question. It says 2026 at the bottom of your motion, but you said 2027.
I don't know why I did that. That's horrible. Yes, it's supposed to be plan year 2026.
Just making sure we're all on the same page.
Yeah, sometime in the middle of 2026 would be my guess as to when that sufficient data comes available. And to be clear, again, to those that are coming back to listen to this conversation, January is not when sufficient data will be available.
I would be happy to make that motion.
Dr. Bogan moves to adopt the direction to Pennie. Do we have a second?
Colleen, I will second.
Colleen seconds. All in favor, say aye.
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 Any opposed? Any abstention? Woo! The motion carries unanimously, and Devin, you have a direction and you will be coming back to continue to work on it though. So it's a great first step. So I appreciate everybody's hard work on this. I know Devin's been talking to most all of you from time to time over the last several months. And I think this at least shows our commitment to continuing to work on the issue. And I know Devin will be in touch to kind of clarify these last couple of points as we continue to work towards our October meeting, and then have plenty of time before plan year 2026 to get to work through maybe some focus groups or something along the way in terms of consumer testing. So certainly appreciate everybody's efforts here. Devin, what's that move us to next on the agenda? Any other business? Anybody have anything else coming up? Devin, do you have anything else?
No, that was it. I was just going to highlight that there are some appendix slides with more information about the Q2 budget, the state subsidy screenshot, some more unwinding data. So if anyone who's interested, please feel free to take a look at those and let us know if you have any questions. But that was it for the agenda today.
Very good. So we are going to adjourn this meeting because we're moving to an executive session. The agenda for the executive session is limited only to discussing legally privileged or confidential matters, to seek legal counsel, discuss personnel matters, or to review or discuss agency business that is legally protected by law. So this full board will not be coming back to this session. Those that are on the personnel committee, we have a second meeting, a second invite for that executive session discussion. Let's take a break of 7 minutes and come back and plan to go to that other meeting at 2:45. So thank you everybody for your participation. This Pennie board meeting is adjourned. Thank you.
Thank you.
Thank you.